I'm Dr. Rohit Gutgutia and I practice in fertility at Nova IVF Fertility East Hospital as the medical director. We are here to talk about prostatitis. Prostatitis is an infection of the prostate gland, which is a small walnut-shaped gland at the base of the bladder in men. Infection of the prostate or prostatitis is a pretty common problem, and we see many men are surfing the internet to know about the causes, the symptoms, and the cures. Hopefully today, reliable answers. Prostatitis is basically inflammation and infection of the prostate gland. The prostate gland is a small walnut-shaped gland at the base of the urinary bladder of men. Very often this gland gets infected and leads to various symptoms and signs, and many people suffer from this disease. Almost 1 million men attend OPDs or clinics in India alone every year with this problem. Prostatitis also affects fertility and leads to infertility-related issues in many men. Prostatitis is infection of the prostate gland caused by bacteria. Various bacteria that are commonly present in the digestive tract like E. coli, Proteus, Klebsiella, Pseudomonas, when they affect the prostate, that leads to infection of the prostate or prostatitis. Some people, they may have damage to the prostate or the nerves supplying the prostate during surgery or because of diabetes or when they had some injury to the prostate while riding a horse or a bike riding, etc. Mostly, prostatitis arises out of either infection or injury to the prostate gland. Prostatitis is a problem that affects young men and middle-aged men. The commonest problem that prostatitis causes is with the urine. People find it difficult to pass urine. They have a burning sensation while passing urine. The frequency of passing urine during the night time or nocturia, and often they have some blood or a cloudy urine that comes out when they pass urine. These are the commonest symptoms of prostatitis. Other than that, backache or pain in the groin region or the pelvic region or even the genitals that some people may suffer from. Rarely, you could have infection mimicking a flu, so you would have fever and chills and rigor along with that, which may also be because of prostatitis. We have to maintain a very good hygiene as far as possible. In the private parts, whenever we pass urine or use a public urinal, we'll have to ensure that we keep our organs clean and tidy. We also remember that it also happens to people who are not moving or are sitting for long times because the sweat and other infections are accumulating. For these people, it's very important they should get up once in a while they're doing work while sitting down and walk around a little bit. Similarly, for obese patients, it's very important they should try and work on their body weights so that they maintain a good BMI and the infection doesn't happen to them. Most importantly, I would say, there is a role for diet and exercise as well. Try and avoid coffee, alcohol, acidic food, which kind of dehydrates you, and try and take lots and lots of vegetables, proteins, especially the plant variety, and keep yourself well hydrated with lots and lots of liquids. Prostatitis is basically infection caused to the prostate gland by bacteria. These bacteria are commonly present in the digestive tract. It is usual for the treating physician to prescribe common antibiotics, and luckily, in most cases, the infection resolves also with such treatments. Rarely, however, we may come across cases of chronic bacterial prostatitis with infections deep-seated and a longer duration of antibiotics may be required or prescribed. In addition, we always have to remember that strict hygiene and certain lifestyle modifications, as we've discussed, also go a long way in preventing and curing prostatitis. To conclude, prostatitis is a common problem but can be easily managed. Young men and middle-aged men have to be careful because it affects them more frequently. In case you have any of the symptoms of prostatitis, please make sure that you see your doctor as soon as possible. There are certain lifestyle measures that we discussed: strict hygiene, maintaining your weight properly, exercising, and above all, safe sex is something that you need to practice to stay away from prostatitis.